The pandemic is really taking a toll on all of us. You're dealing with the social distancing, the isolation. It's been difficult. Chaplain Joe Hart, the Director of Spiritual Support at GBMC, joins us now. Thank you so much, Joe, for joining us.
My pleasure.
You know, this is so much anxiety and stress, something like we've never seen before. Help us get through this. How do we handle this?
Well, I think it's a day at a time with any of us, especially those of us here in the hospital where we meet patients who are in a place of distress and unsuredness where, because of our desire to keep them safe and our staff safe, precautions are necessary, but sometimes visually overwhelming. And so our goal is to strive to bring that sense of reassurance, emotional, psychological, or spiritual in my case. Our goal as chaplains is to be that source of hope, source of coping, a source of helping our patients realize that they are not alone in this journey, and that through it, and is our goal, that they will be better.
What are some of the ideas, Joe, that we can use for better taking care of our mental health and finding some comfort and support?
Well, there are a couple words that I'd like your viewers to understand that I'd like to suggest for our community. And that is one word that for me is so important is the word abiding. What does it mean to abide in love? And whether that be a community member who we love because we are fellow humans, whether it be a spouse of many years, a child, a parent, abiding with each other to me is that sense of that we are connected. And keeping and staying connected with each other, how or through by whatever means it takes, to me is really one of the crucial ingredients to regaining and reclaiming one's health.
Does GBMC offer any tools, any support for people, especially with family there in the hospital?
Absolutely. One of the things that we have developed over this time, which is a new frontier for us, as is true in many other healthcare areas, is virtual communication, virtual connection, virtual abiding. And so what we're developing and have developed actually are iPad communication, virtual communication with our patients and their family members so that they, again, can stay and feel connected to those they love.
All right, and I'm sure this is great for the staff as well, because this is emotionally draining on them as well, the healthcare providers,
Absolutely.
The ones on the front lines.
And so we're there to personally be for our staff. We regularly make rounds. We have developed various prayers that are printed that we are handing out, a version of the Serenity Prayer in a 3x5 card that we can literally give to our staff. They can put it in their pocket or their smock and have that for a break or a time when perhaps they're feeling a little angst and that they can feel a sense of refreshment during their day.
We can all use that. Chaplain Joe Hart, thank you so much for joining us, and hang in there.
Absolutely. Thank you.